Epidermolysis bullosa by Jessica Allis. What is epidermolysis bullosa? Also known as EB. It's a genetically heterogeneous inherited skin disorder characterized by structural anomalies that cause disruption to the dermo-epidermal junction or in the basal layer of the epidermis. This causes the skin to become very fragile. Any friction or trauma to the skin can cause painful blisters and open wounds. In more severe cases, the blisters may occur inside of the body, in the mouth, and in the lining of the stomach, and this is usually noticeable at birth. There are different types of EB. There's epidermolysis bullosa simplex, EBS, dystrophic epidermolysis bullosa, DEB, junctional epidermolysis bullosa, JEB, epidermolysis bullosa acquista, EBA, and Kindler syndrome. I'm going to go over the three most common ones. The first one I'll talk about is epidermolysis bullosa simplex, so EBS. This is the most common type of EB. In more mild cases, the blisters occur only on the hands and feet of the newborn. Later in life, the skin may stop blistering, but the individual may be left with hard, thickened skin on their palms and soles of their feet. There are also more severe cases of EBS, where the blistering can occur anywhere on the skin and even inside the mouth. This can cause the nails to be rough and thick, or even completely gone. When this happens, the blistering tends to be more serious at birth, but lessens in severity as the child gets older. And there's typically little scarring once the skin clears up. Here are some pictures of EBS. There's also dystrophic epidermolysis bullosa. The symptoms can be either mild or more severe. In mild cases, the blisters tend to develop only on the hands, feet, elbows, and knees. And in more severe cases, the blistering can be more widespread and include areas of even missing skin. The blisters can also develop in the mouth and esophagus. And when the blisters heal with this one, scars do tend to form. With continuous blistering on fingers and toes, they can end up fusing together. Here are some photos of DEB. Next, we have junctional epidermolysis bullosa. In mild cases, blisters usually develop only on the infant's hands, elbows, knees, and feet. Blistering tends to lessen by 2 to 3 months of age. In severe cases, though, the blisters can develop on large areas of the body or digestive tract. And JEB can also cause scarring when the blisters heal and also cause the fingers and toes to fuse together. And in very serious cases, a child with JEB often dies within the first year of life. Here are some pictures of JEB. Etiology. 1 out of every 20,000 births in the U.S. are affected by EB. Most types of EB are inherited. It is caused by a gene mutation that makes the skin very fragile. A child with EB may have inherited the mutated gene from a parent who also has EB, or they might have inherited the faulty gene from both parents who are carriers but don't have EB themselves. If the disease gene is passed from one parent who has the disease, it's an autosomal dominant inheritance. If the disease gene is passed from both parents, it's an autosomal recessive inheritance. It can also arise as a new mutation in the affected person that can be passed to their offspring as well. EB affects both boys and girls equally, and it can affect all ethnicities. Some of the manifestations include fragile skin that blisters easily, especially on the hands and feet, nails that are thick or even don't form, blisters inside the mouth and throat, thickened skin on the palms and soles of the feet, hair loss and scalp blistering, thin appearing skin, dental problems such as tooth decay from poorly formed enamel, dysphagia, and itchy, painful skin. Diagnosis. They can do a skin biopsy for immunofluorescent mapping. This is where a small sample of affected skin is removed and examined with a microscope in reflected light to identify the layer or layers of skin that are involved. This test will also identify whether the proteins needed for skin growth are functioning. And you can also do genetic testing through a blood sample, and then prenatal testing as well. So if there's family history, individuals may consider prenatal testing and genetic counseling. Pathogenesis. Epidermolysis bullosa simplex is usually dominantly inherited and involves disorders of the genes for keratins 5 and 14 and plectin. Dystrophic EB is caused by a mutation in the collagen 7 gene and can be dominant or recessive. Junctional EB is recessively inherited and involves mutations in the genes for several components of the junction between the epidermis and dermis, such as laminin 332 and plectin. Some of the complications are infection, just from the blisters. They're very vulnerable to bacterial infections, sepsis, fusion of fingers and changes in the joints, nutritional problems, constipation, dental problems, skin cancers, and death. So for treatment, there is no cure to EB. So a lot of it is going to be preventative care, including extensive wrapping of the skin with non-adhesive protective dressings, regular bathing and wound care, and medications for pain, itching, and to fight off infections. Sometimes there are surgeries needed, so possibly a feeding tube to get the food directly into the stomach and improve nutrition and weight gain, skin grafts, surgery to widen the esophagus if the scarring has caused esophageal narrowing, surgery to correct the fusing of fingers and toes to restore mobility, and researchers are studying different treatments, so possibly in the future things like gene therapy, bone marrow transplants, and protein replacement therapies might be possible. Prognosis and outlook. So the outlook for those with EB depends on the type and severity of their condition. Some mild cases will start improving with age, and they can grow up to live a pretty normal life. And then there are those more severe cases. So in some of the severe forms of the disease, they can result in disfigurement, disability, and early death. The life expectancy for children of EB really varies. Children with the JEB, it's pretty poor though. Half don't survive past the age of 1, and many die before the age of 5. Some people with severe EB die in their 20s or 30s of a skin cancer called squamous cell carcinoma. Here are a few of my references. For EB, I feel like it would fit best in our patho book in chapter 13.